Okay, today we'll learn something about Madelung disease. Okay, Madelung disease. It is a definition. Definition is basically a deformity. It is basically a developmental deformity of anteromedial radial growth plate. Okay, so what happens here is you have the ulna, you have the radius. Okay, so the growth plate on the medial anteromedial part won't grow. It is there is a developmental anomaly on the anteromedial growth plate. Okay, the lateral part of the growth plate is just fine. So what happens? There will be shortening on the anteromedial part. If there is shortening on the anteromedial part and continuous growth of the lateral part, what happens? There is bowing. Okay, bowing. So the lateral part and the posterior part, that is the dorsal part. Okay, only the anteromedial part is not growing. So the dorsal part and the lateral part will be continuing to grow. So there will be bowing in posterior direction. Okay, also what happens is it will start pulling the carpals. Okay, the carpals are attached to the distal radius by multiple ligaments. So you have the lunate, you have the scaphoid, you have the triquetrum. Okay, this is called the Virchow's ligament. Okay, sorry, Vickers ligament. Vickers ligament is radiolunate ligament. Okay, one more important ligament we have is radio-triquetral ligament. Okay, also because of the pull and the empty space created here, there will be proximal migration of carpals. And there will be positive ulnar variance because of the radial shortening. There will be bowing of the ulna also. And there will be, because of the bowing, the interosseous space is increased. Okay, and like we told, there is defect in the anteromedial part. So when you see it from the lateral view, what happens? You'll see that the radial tilt is also increased. Okay, so if the lateral part, the anterior part is not growing and the posterior part is growing, there will be increased tilt and this will be pulling the carpals down also. There will be volar subluxation of the carpals. So your hand deformity will be volarly displaced hand. Something like this. Increased radial tilt. Normal will be 10 to 15 degrees. Okay, here there is increased radial inclination. Okay, that means the ulnar inclination of the radius. Radial inclination, normally it will be 20 to 25 degrees. Okay, so now there is volar displacement of the hand. Okay, so what will be the presentation be like? patient will present with obviously wrist pain, chiefly because of ulnocarpal impaction. Wrist pain, okay, and there will be broadening since there is a separation of the both the bones, that is increased interosseous space. There is wrist widening, okay, then there is a volar displacement of the hand, there is a reduced grip, okay, and see the range of motion, okay, restricted range of movements, okay. So remember, it is not just the wrist movements we are talking about, there is radial shortening, so even the radio-ulnar movements is also restricted. So what are the wrist movements? Dorsiflexion and plantar flexion. Since there is volar displacement, what happens? There is increased palmar flexion, reduced dorsiflexion, okay, and the radio-ulnar movement I told you, that is restricted pronation, supination, okay. So this will be the presentation. What will be the X-ray features? Like we already discussed, you have actually already discussed the X-ray features. You have ulnar variance is increased, bowing of the ulna, bowing of the radius, short increased radial inclination, increased radial tilt, okay, proximal migration of the carpals, ulnocarpal impingement, okay. So these are the features of the X-ray. Now coming to the treatment part. What is the treatment you will be looking at? So treatment will depend on whether the presentation is early or not, early or late. Early is before the skeletal fusion, late is after skeletal fusion. So if it comes late, there is not much you can do. You can just do osteotomies of radius include dome osteotomy, okay, and since there is a posterior bowing, you can do posterior closing wedge osteotomy or anterior open wedge osteotomy, okay. After osteotomy, obviously you will be filling the gap with bone graft since it is skeletally mature, okay. Then you have ulnar osteotomy, that is ulnar shortening procedure, Kappanji Save, okay. So coming to early presentation wherein the growth plate is not yet fused. So what you can do, coming to the early presentation, that is wherein the growth plate has not yet fused. So what you can do is you can remove the diseased growth plate. It is called epiphysiolysis. But after removal of the growth plate, you still want the growth to occur. So what do? You do fat interposition, okay. So this is called Vickers procedure. Okay, it is called Vickers-Nielsen's procedure actually. So you remove the deceased growth plate is removed, okay. This can be done only if they have presented early, wherein there is not too much of deformation. But even if they are presented early but already the deformity has set in too much, what do? You go for osteotomies again. So what is the osteotomy? Combined osteotomy of the radius and ulna, okay. Or one more procedure you can do, it will be for late presentation, you can just fuse all the epiphyses, that is called epiphysiodesis of both radius and ulna.